Already the Delta variant that sent Israel back into mitigation is a growing presence in Illinois. We expect it to dominate our cases statewide by the fall. The lessons here at home and across the world are a harbinger of what could happen here, particularly in low vaccinated areas.
So that's the governor of Illinois urging Americans to get their COVID shots today as this Delta variant continues its rapid spread. It's already forced Sydney, Australia into a 2-week lockdown. There are a lot of questions about this. Back with us again tonight, thankfully, Dr. Nahi Bhadia, an infectious disease physician, medical director of the Special Pathogens Unit up at Boston University School of Medicine. So, Doctor, WHO came out today and said, in effect, masks back on if you know you're going to be in a Delta variant concentrated environment. And yet in this country, masks are coming off coast to coast, and we've been told by a lot of physicians, you don't have to worry if you're fully vaccinated. You don't have to worry about this Delta variant. Please tell us what is the truth.
Well, Brian, the way that I think of it, and I was scratching my head all day trying to figure out the best metaphor, and this may not be the right one. Right now, what's happening is you're seeing places, we just talked about Sydney, places that have low vaccination rates are really where we're seeing exponential increases in cases from Delta. It's a lot more transmissible. It may cause a bit more severe disease. But what you're also seeing is in areas like Israel and UK, which are highly vaccinated, in those areas, you're seeing, again, huge number of cases among people who are not vaccinated. But then there's a spillover in people who are vaccinated. You're seeing breakthrough infections. And so why is that happening? People are concerned. By the way, most of those infections are asymptomatic or mild infection. In rare cases, they're hospitalizations in people who may have immune conditions or maybe older. So here's my metaphor. If it's drizzling outside, your metaphor, your vaccine could be your raincoat. You go outside, you're much less likely to get sick, and think of that as a number of cases, the amount of Delta variant that's in your community. If it's completely downpouring outside, there's tons of Delta variant, huge number of cases, even with your raincoat, there's a risk that some people will get wet. And that's why I think that the guidance, and what we've said, and I think the CDC said this as well, is that if you have medical conditions, if you're immunocompromised, you have conditions that reduce the efficacy of the vaccine, it may be safer for you to continue to wear those masks indoors. And that's what I am recommending as well. But if you're healthy, again, the risk here seems to be for mild disease in most cases, or asymptomatic disease. And that's where you need to use your personal judgment, acceptance of risk.